Do quarantines, isolations, and social distancing measures work to contain the virus? New, the 3rd of October 2020. Yes, for the most part. When the epidemic of COVID-19 first exploded out of Wuhan in January, officials in China and other countries began issuing quarantines, imposing social distancing measures, and setting travel restrictions. China locked down tens of millions of people in late January. For instance, in the Hubei province, where Wuhan is located, officials implemented so-called social distancing measures, cancelling events and gatherings, closing schools, having people stay at home, and upping sanitation and hygiene measures. Meanwhile, other countries issued travel restriction. The United States, for instance, barred entry of some foreign nationals with recent travel to China. Further reading: Americans on coronavirus cruise ship barred from U.S. after failed quarantine. Some public health experts were critical of the moves, calling some of them draconian and ineffective. For instance, quarantines, which can clumsily round up the sick with the healthy, may not prevent the spread of disease, which we certainly saw on the Diamond Princess cruise ship, quarantined in Japan, and travel restrictions in our highly connected world are inevitably leaky, enlarged CDC. But proponents of the policies were quick to argue that the measures were never intended to hermetically seal off cities or countries. Rather, the moves were intended to slow down the spread of disease. This can buy officials time to prepare, help avoid overwhelming healthcare facilities with a burst of cases, and in the end, lower the overall case counts in an epidemic. According to the latest data, those proponents of the measures were, on the whole, correct. In the WHO China Joint Mission Report, the group of experts estimated that China's massive efforts to contain the virus have averted or at least delayed hundreds of thousands of COVID-19 cases in the country. This, in turn, had helped blunt the impact on the rest of the globe. They add, further, in a new non-peer-reviewed, unpublished study, an international team of researchers estimated that without the measures, the number of cases in mainland China would have been 67 times higher, and if officials had begun implementing them just 1 week earlier, cases could have been reduced by 66%. If they had implemented them 3 weeks earlier, cases would have been reduced by 95%. The study appeared on a medical preprint server March 9. Likewise, in another non-peer-reviewed, preprint study, this one led by epidemiologists at Harvard, researchers estimate that early interventions, quarantines, social distancing, contact tracing, etc., successfully and dramatically blunted the peak burden of disease in the Chinese city of Guangzhou. In a Twitter thread March 10, one of the co-authors of that study, Harvard epidemiologist Mark Lipsitch, noted that as community spread increases, social distancing, however painful, becomes essential to slowing and minimizing the impact of disease. In the thread, he references a comparison of outbreaks of the 1918 pandemic flu in Philadelphia and St. Louis. In Philadelphia, authorities downplayed the spread of disease and did not issue social distancing measures quickly. They even went forward with a citywide parade as the disease spread. St. Louis, on the other hand, quickly implemented social distancing measures within days of the area's first reported cases. The graph below shows how well things worked out for each city.